If you have not told Maria or Kat what the size of your masks are, I know there's a list going around. There's a variety of brands of N95s, and you need to make sure whatever brand you're wearing today fits you properly.
Just a few huddle topics. What's been happening is body bags are ripping, and if they have bile or any secretions from the patient, the security officers will get contaminated. So please make sure all the belongings are attached to the bags.
When we first started encountering patients who were having COVID-like symptoms, we did our best to get them into the department. We were trying to make sure they were consolidated either in one place or in isolation rooms.
We got a phone call saying we had our first patient, and I realized that in order for me to lead my nurses, I have to be the first one, because I am not going to push them into doing something that I personally won't do first.
When it first hit me was when we received the patient. She was demanding oxygen. I can't breathe, I can't breathe, and she just snatched the oxygen from me.
And then it was like a tsunami. It just totally took over. People were just desperately trying to save lives, desperately trying to keep patients going.
You just do what needs to be done. It's not the way you would normally do things, and you figure it out. You figure out what you need to do and how we're going to do it, so that we can provide care. Like, look at the waiting room right now.
All our rooms were filled, and that was when we converted the whole waiting room into a treatment space. I remembered how it is to work in a provincial hospital. Back home, patients would be everywhere, and it would be in a basketball court. So I used that as a form of guidance for me.
The fear, when it just didn't seem like anything would stabilize these patients. Pumps of 6, 7, 8 medications running at a time. We just did not understand at the beginning how it would weave through a person's body.
We spent 16-hour days, 7 days a week. We didn't even have time to think or decompress.
Part of the reason I work so much is because I couldn't sit home knowing that there is a population at need and people that needed care, and that we were all strained. So while I was healthy, I was going to work and I was going to help as many people as we could help, including my coworkers.
I've been a nurse for 30 years, but I've never had 5 patients die on the same day. I cried many days. Because their families weren't there. So I knew how the family would feel.
Seeing so many sick and so many dying, it gets to you. And you're always going to remember it. And everybody's so appreciative of healthcare workers now and frontline workers now, but don't forget us in a year when we're reflecting back and we are remembering everything that we had to do during this time, because we're gonna need help then.
I asked myself, will it be easier the second time around? I don't know, because the uncertainty and the unknown is just like this force that keeps on weighing in my head.